Well, I do also want to thank you for inviting me to be here. When I was thinking about coming to this, I have to say I was a little intimidated because I looked at some of the bios of the folks coming and thought, whoa, I'm way in over my head here. But I do want to bring a little bit of sort of what Jacqueline was saying at the state level to the federal policy issues, because that is where I work. In my area at HHS, I have responsibility for child care, the Child Care Development Block Grant, Head Start, Early Head Start, the home visitation program, at least for the tribal populations, and then work in partnership with our other agencies for the rest of that Race to the Top, and then the impacts of child health on these programs. And so I think, you know, the span is pretty big, and we're making very important decisions. As many of you know, there's been a lot of focus in the country on early education. I want to challenge one thing that was said earlier. In terms of where we start, we absolutely start actually prenatally, but absolutely start at birth on. And I think the body of research that has been put out in the last 10 to 15 years on the brain development and the science around children's development in every area or all of the domains is absolute, and we really need to be thinking about this as an issue from birth to 5, as we are in the departments, both education and HHS. And Jacqueline didn't say one thing. She and I were colleagues for a better part of a year in implementing many of these things, and so she does, you know, I echo many of the things that she said in her comments about the speed at which we work, et cetera. They're all absolutely true. I always say that good policy is actually a combination of 3 things, and this comes from my observations of working on the Hill. And I did work 2.5 years for Senator Kennedy on the Help Committee and watched policy being developed for, you know, those years and what it took to really move the needle up there. And I always say that it's a combination of good research and evidence when it comes to programs, what works, what doesn't work, good data, and then human stories. And I don't think that we can take one of those without the other. And I saw that over and over and over again. You can quote the research to policymakers and you can lose them if you don't bring in the human aspects of what it is we're trying to do. So I think those 3 things always enter into any of the things that we are looking at the Department of Health and Human Services. So obviously, cost-benefit analyses of our programs is important. And I know that yesterday you heard about the 3 major studies, and I'm not going to go into those. I'm certain that everyone here understands the Perry Preschool Project, Abecedarian, and the Chicago Parent-Child Center projects. I would comment on one thing about those studies, though, and I would challenge this group as you think forward in terms of where we go with cost benefit. And it is one of my observations, is what how I would define it. One of my observations of all of them is they tend to be generalized to a program and not actually make good, solid points on all of the other aspects that go into those programs. And a case in point is the issue around parent involvement and the critical role that parents play in any one of these programs. And I think forever we have, you know, paid attention to the Perry Preschool Project, thinking of it as a, you know, a part-day pre-K program, when I think one of the more important aspects of that program was the weekly home visitation that occurred along with those. And it also, you know, sort of influenced what we do in Head Start around parent involvement. But I think sometimes we miss that aspect of it. There are other pieces of, you know, these things that need to come into play. So the outcomes and the cost benefit for the children is one thing, but for other aspects, it's equally important. And what was the impact on parents in these things? Not just the parent-child relationship, but also on, did the programs change parents as parents and parents in relation to their communities in any way? And I think we need to understand that better. And possibly go back and look at some of these studies with a little bit different lens and a different angle. So we have a ways to go, but there are other pieces that, come into play. I mean, there are things like, what is the impact on parents' work? Their ability to go to work and maintain a job and get themselves out of poverty situations. So these impacts are multiple and I think need to be thought through. I will say that these 3 studies have really been the catalyst for moving early education onto the public radar screen, and I will always say that if it had not been for these 3 studies, I'm not sure where we would be today in terms of our looking at early childhood and our public awareness of where we need to go as a country. So I think that the cost-benefit analyses done on these programs has been hugely important, and I would say, and I'm going to give you some reasons why I think we need more of them, and I wish we had them actually right now, because we are making some decisions as we look forward to the future of where we're going with Head Start in particular, but how we also get our arms around the child care situation in this country. And I could go on and get off on a soapbox, but suffice it to say that it is a disaster, a national disaster, and one that needs to get rethought in terms of how we are funding and working with the child care programs around the country. It's we have a long ways to go on that. So what is our job as policymakers? Well, obviously it's to make the best decisions we can with what we have at our disposal with limited resources. And that is our world all the time. And I will tell you that sometimes it is a very, very difficult choice to make, because some of the choices we are making are really, for example, in childcare. We have a block grant that has been flat now for almost a decade, no new money in it. Now, the question is every time, how do we ensure quality when the money is flat and people have this adverse reaction to cutting slots? And so what has happened over time in childcare and what we're confronted with is we keep cutting the funding going into a program and pushing down the quality, actually lowering the quality of childcare in this country because no one is willing to make the decision to actually cut slots. So we find ourselves in a debate over which is more important, cost or access. And it's a debate that we at HHS really don't want to be having and actually don't engage in that. We really need to ensure with federal money that we are providing the best quality we can with federal resources to poor children. So I think that's one of the things. We have these decisions that we make all the time. Some of them are not, necessarily very pleasant to make, and no one is happy at the end of the day on these, but we do have to, or not everyone, I should say, someone's always unhappy at some of these choices. So what are some of the issues that we are looking at in terms of this whole idea moving forward? We are looking forward towards reauthorization of Head Start in the next few years. And so we have decisions to make. And here are some of these are actual decisions that we are really contemplating right now. For just assuming a flat budget, which is where we have to begin our work. What is more important and a more important investment in terms of the program? To make it a longer day, make it a longer week, or make it a longer year? And every one of those has enormous budget implications. And so where are we going to get the most bang for the buck with those 3 choices? And there are all choices that we are struggling with, and I would say without much research or analysis to help us with them. We are really trying to do our best in sorting that out. As Jacqueline talked about, the pay of the teachers. Teachers in Head Start make probably about half of what teachers make in the public school system, not quite. But we are underpaying teachers with BA degrees, severely in this country. Okay, a decision that we have to make going forward is, do we begin to increase the pay of the teachers, or do we cut children? Those are the kinds of decisions that policymakers have to deal with. The numbers of children served in the program or serving the children better. And that really is, you know, a serious thing when it comes to things like quality of program and curriculum investments and some of the issues surrounding support for the programs. I mean, we have in Head Start, I think, trimmed as much as we can. And as you probably all know, over the past year, the results of sequestration were severe in Head Start. Because we have reached the point where there's nothing left to cut, really. And so you can't cut the wages much below where they are because they're not much above poverty in many cases anyway. So programs are being now forced to make those hard decisions of cutting children versus, you know, any more cuts to quality. There are just simply no places to go. Another question that we're struggling with right now, and I think it's been alluded to, we have interesting conversations, and one of those has to do, we talk about the dosages, you know, and back and forth. And what do we really mean by that? Well, it means how much of whatever the program a single child gets. So what is the most important thing for us? Is it for one child to get 2 years, 3 years, or 4 years of early childhood, or more children to get 1 year? And those, again, are decisions that we're having to deal with as we look at any efforts to improve the program in the future. Those are some of the big issues. Another one that we're looking at is the impact of these programs on children, whether is it better to have targeted programs where you take and isolate children, mostly poor and mostly minority children, into groups of or like classrooms, or is it better to move towards integration of these children into other programs where they have the access to other exposure and access to other children with more advantaged backgrounds? And if you do that, how do you cost that out? And what are the implications of that for the future? So as you can tell, we do make difficult decisions, and I would say that in almost every one of the decisions that we're looking at right now, we don't really have much data to go on. We've got a lot of research where we know where the impact of these programs on, you know, on the brain, you know, I mean, or the development of brain, et cetera. But actually, what do we know about the interventions is really somewhat of, you know, still an enigma to us. The role of parents as we move forward, again, in Head Start, we have hung on to and, you know, and our a requirement that all programs are comprehensive and include parent engagement. But what about parent engagement really works? Is it parent meetings? Is it home visitation? What is it, and how do we engage parents in ways that will make meaningful change for themselves and their children? And we don't know that with a lot of certainty at this point. There were a couple of other things I wanted to point out from the conversations this morning. Is it my time? Oh. Someone mentioned the QRIS, and this, again, I really want to caution people to think carefully. We have quality rating improvement systems that we have been implementing across the country. I wanted to caution people to not overpromise or over-expect from QRIS structures, because from you know where we sit, they are infrastructures, they are frameworks on which to build quality programs. They are not themselves an intervention. And so if we try to move too quickly to looking at the outcome of these QRIS systems on children, we will probably be doomed to fail. And I really do caution people about how we begin to look at some of what's going on in early childhood. I think another thing that I would say is the importance of what you all do in terms of making this. One of the things I didn't say is I spent many years working for the Defense Department, and I had a colonel one time who said to me when we were talking our mumbo-jumbo about early childhood, "Talk simple, stupid." And I think there's a lot of wisdom in that, because one of the things that we struggle with is how we interpret what you all are working on to the average person out in the public. First, this needs to get out to the public, and then it turns into policy. And I can't say that enough. If we don't have the public behind us, we don't get policy to speak of. And so how we translate research and cost-benefit analysis into things that the public understands in simple, stupid language, we miss an opportunity. And I think that is one of the things that is a serious problem that we have right now with the Head Start Impact Study, and I know that you talked about that here yesterday. That was a very complicated study, and what is the simple, stupid, phrase that we could say to the public that we learned from that study? And I'm out of time, so I need to close it down here. But there are some other things that we are thinking about, but I think as we move forward, I would just caution you to think carefully about the interpretation of what it is that you do, not just for policymakers, but for the public as well, because these things do matter to us. We need much more of what you do, and I can't stress that enough. So again, thank you for the opportunity to speak today.